Imagine walking into a hospital, getting one aspirin, and later discovering you were charged $30 for it. Not $30 for the whole bottle, $30 for one tiny pill. Now, here's the weird part. The exact same aspirin can cost less than 3 cents at a grocery store. That's not a discount. That's a difference of almost 1,000 times. People have reported being charged $40, $50, and sometimes even more for a single aspirin during a hospital stay. And no, somebody didn't accidentally hold down an extra zero. At first glance, it sounds like the hospital bought its aspirin from a luxury jewelry store. But hospitals aren't simply paying more for aspirin than everyone else. In reality, something much stranger is happening behind the scenes. Because the real story isn't about aspirin at all. It's about how hospital pricing works in America. So why does a pill worth a few cents suddenly cost $30 the moment it crosses a hospital wall? And more importantly, who actually gets that money? Most people think the answer is simple. Hospitals buy medicine, hospitals sell medicine, and hospitals mark up the price. In other words, many people assume the hospital sees a 3-cent aspirin and decides to charge $30 because it can. And honestly, when you first see the bill, that's a pretty reasonable guess. After all, if a restaurant charged $30 for a French fry, people would probably start a protest before dessert arrived. But healthcare pricing works differently from almost every other business you deal with. When you buy a phone, you know the price before paying. When you buy groceries, you know the price before paying. In healthcare, people often receive the bill after everything is already finished. That's a little like boarding a plane without knowing whether the ticket costs $200 or $20,000. And because patients rarely see prices up front, a completely different system evolved behind the scenes. A system so complicated that even many doctors don't fully understand how the pricing works. The aspirin charge is simply the easiest place to notice it because everyone knows what aspirin normally costs. Nobody blinks when a complicated surgery costs thousands of dollars. But everyone notices when a tiny white pill suddenly costs as much as dinner. And that's exactly why aspirin became one of the most famous examples in hospital billing. To understand where the money goes, we need to meet something called the Chargemaster. A Chargemaster is basically a giant hospital price list. Every test, every bandage, every pill, and every service gets assigned a price. Some hospitals have thousands of entries inside these systems. Think of it as the world's most expensive restaurant menu. Here's where things get interesting. The Chargemaster price is often not the amount hospitals actually expect to receive. Instead, it often acts like a starting point for negotiations with insurance companies. Imagine a hospital lists an item at $50. An insurance company negotiates a discount and agrees to pay $20 instead. Suddenly, the insurance company can tell employers and customers, "Look how much money we saved you." But that raises a much bigger question. If the listed price isn't the real price, then how do hospitals decide what that number should be in the first place? The truth is, there isn't one universal formula. Different hospitals build their price lists in different ways, and those prices can be influenced by years of negotiations, operating costs, and local market conditions. But here's what matters. The aspirin itself is usually one of the cheapest parts of the entire process. The bill is often covering everything surrounding the pill. Think about it. Someone has to purchase the medication, store it safely, track expiration dates, monitor inventory, and make sure the right patient gets the right drug. That doesn't magically make a 3-cent pill worth $30, but it does explain why hospitals argue they aren't simply charging for the pill itself. Now, let's look at a real example. In 2013, a patient at a hospital in California was reportedly charged about $55 for a single aspirin tablet during a hospital stay. The story spread quickly because people knew the same aspirin could be purchased in stores for just a few cents. And honestly, if somebody tried selling a $55 aspirin at a pharmacy counter, they'd probably spend the rest of the day explaining themselves. But hospital billing doesn't work like a normal retail transaction. Most payments involve insurance companies, government programs, or negotiated contracts. Let's use a simple example. Imagine a hospital lists an aspirin charge at $30. An insurance company may have a contract saying it only pays $5 for that item. The hospital doesn't receive $30. It receives $5 because that's the negotiated amount. But here's the catch. Patients without insurance may sometimes face the full listed price unless discounts are applied. And that's one reason hospital pricing receives so much criticism. Two people can receive the exact same aspirin and end up facing very different bills. In recent years, federal transparency rules have required hospitals to publish many of their prices online so consumers can compare costs more easily. The goal was simple. If people can compare prices when buying a television, they should be able to compare prices when buying healthcare too. But healthcare is still far more complicated because most people don't know exactly what treatment they'll need before arriving. Nobody wakes up and schedules a surprise appendix removal the way they shop for a new laptop, and that makes normal price competition much harder than it is in most industries. Let's look at another famous example. In several publicly reported hospital bills over the years, common items like adhesive bandages, saline bags, or over-the-counter medications showed prices many times higher than store prices. The reason these examples attract attention isn't because they're the largest charges, it's because they're the easiest charges to understand. Most people don't know what a complicated surgery should cost, but almost everyone knows aspirin isn't supposed to cost as much as a fancy steak dinner. That's why the aspirin becomes a symbol. It turns an invisible pricing system into something people can immediately recognize. And once people start questioning the aspirin, they start questioning everything else on the bill. Here's the twist most people miss. The biggest problem may not be the $30 aspirin itself. The aspirin is just the messenger. It's the tiny clue that reveals a much larger pricing system operating behind the curtain. If hospitals charged 3 cents for aspirin tomorrow, many people would cheer. But the underlying system would still be there. The real issue is that healthcare prices are often disconnected from what ordinary people expect to pay for everyday goods. And when prices become difficult to understand, trust becomes difficult to maintain. So the next time you hear about a $30 aspirin, don't just ask why the pill costs so much. Ask what that tiny pill is revealing about the entire healthcare system. What surprised you more? The fact that hospitals can list an aspirin at $30, or the fact that the listed price often isn't the amount they actually get paid? Let me know in the comments. And if you enjoy simple explanations that uncover how money really moves behind everyday systems, make sure you like the video and subscribe for more.